Hello guys, I am Dr. Robot. Today we are going to discuss about a common disorder, hypertension. Hypertension is also known as the high blood pressure. It is a long-term medical condition in which the blood pressure in the arteries is persistently elevated. The systolic blood pressure will be more than or equal to 140 mmHg and the diastolic blood pressure will be more than or equal to 90 mmHg. The hypertension is generally classified into two major types, namely primary or essential hypertension and secondary hypertension. The primary or essential hypertension, in which the cause of increase in blood pressure remains unknown, that is, it remains idiopathic. Essential hypertension constitutes about 80 to 95% patients of hypertension. Secondary hypertension, in which the increase in blood pressure is caused by diseases of the kidneys, endocrines, or some other organs. Secondary hypertension comprises remaining 5 to 20% cases of hypertension. The clinical classification of hypertension. The below mentioned are the normal systolic and diastolic pressure and the systolic and diastolic pressure in prehypertensive and hypertensive cases. Etiology and pathogenesis. The etiology and pathogenesis of secondary hypertension that comprises less than 10% cases has been better understood, whereas the mechanism of essential hypertension that constitutes about 90% of cases remains largely obscure. In general, normal blood pressure is regulated by two hemodynamic forces, cardiac output and total peripheral vascular resistance. Factors which alter these two factors result in hypertension. The essential hypertension. By definition, the cause of essential hypertension is unknown, but a number of factors are related to its development. These are as under. 1. Genetic factors. The role of heredity in the etiology of essential hypertension has long been suspected. The evidences in support are the familial aggregation, occurrence of hypertension in twins, epidemiology data, experimental animal studies, and identification of hypertension susceptibility gene. Racial and environmental factors. Surveys in the US has revealed higher incidence of essential hypertension in African Americans than in whites. A number of environmental factors have been implicated in the development of hypertension, including salt intake, obesity, skilled occupation, higher living standard, and individuals under high stress. The risk factors modifying the course of essential hypertension. The risk factors may include age. Younger the age at which hypertension is first noted but left untreated, lower the life expectancy. Sex. Females with hypertension appear to do better than males. Atherosclerosis. Accelerated atherosclerosis invariably accompanies essential hypertension. Other risk factors. The other risk factors may include smoking, excess of alcohol intake, diabetes mellitus, persistently high diastolic pressure above normal, and evidence of end organ damage like heart, eyes, kidney, and nervous system. The secondary hypertension. Though much less common than essential hypertension, mechanism underlying secondary hypertension with identifiable cause have been studied more extensively. Based on the etiology, these are described under 4 headings. 1. Renal hypertension. Hypertension produced by renal diseases is called renal hypertension. It is subdivided into 2 groups, renal vascular hypertension and renal parenchymal hypertension. The role of kidney in hypertension, particularly in secondary hypertension by elaboration of renin and subsequent formation of angiotensin II, is well established. 2. Endocrine hypertension. A number of hormonal secretions may produce secondary hypertension as follows. Adrenal gland, example in primary aldosteronism, Cushing's syndrome, adrenal virilism, and pheochromocytoma. Thyroid gland, example in hypothyroidism and hyperthyroidism. Parathyroid gland, example hypercalcemia in hyperparathyroidism. Oral contraceptives. Estrogen component in the oral contraceptive stimulates hepatic synthesis of renin substrate. Coaction of aorta. The coaction of aorta causes systolic hypertension in the upper part of the body due to constriction itself. Diastolic hypertension results from changes in circulation. 4. Neurogenic. Psychogenic, polyneuritis, increased intracranial pressure, and section of spinal cord are all uncommon causes of secondary hypertension. Diagnostic evolutions. History collection and physical examination, medical history of diabetes mellitus, complete blood count, chest X-ray, and ECG. The management. Mainly the management of hypertension is possible by two ways, which include lifestyle modification and pharmacological therapy. The lifestyle modification. The lifestyle modification measures mainly includes weight reduction, dietary approaches to stop hypertension, dietary sodium reduction, reduce alcohol, exercise, and stress management. The pharmacological therapy. Various groups of drugs are used for the treatment of hypertension. Collectively, these drugs are called as antihypertensive drugs. The antihypertensive drugs include diuretics, beta blockers, alpha blockers, vasodilators, ACE inhibitors, and calcium channel blockers. Let's discuss the classification of antihypertensive drugs in the next video. Thank you. If you find it easy to understand our lessons, please do like, share, and subscribe to Dr. Medicine. See you in another video.